Detoxing the Discourse, Episode 5, Legal Drug Dealing, an explosive exposé on Big Pharma's murderous hustle. Welcome back to Detoxing the Discourse. Today, I want to introduce you to the biggest, deadliest, most ruthless drug cartel operating in Canada right now. And no, I'm not talking about the guy in the alley or the crew on the corner in hoodies. I'm talking about the most powerful syndicate in the country, one with polished offices, unlimited legal teams, and politicians in their back pockets. They don't carry Glocks, they carry branded pens. They don't run from police, they fund their campaigns. You know them as Big Pharma, but make no mistake, this is organized crime wearing a white coat and a name tag. If you think I'm exaggerating, give me a few minutes of your time, please, because by the end of this episode, you'll see exactly why this empire of suits has killed more Canadians than every street-level dealer combined, and why they're still getting away with it. 1. Introduction. When we hear the term drug cartel, we think of dimly lit rooms, underground labs, armed raids, and mugshots. But the real kingpins? They sit at mahogany boardroom tables under fluorescent lighting. They sign contracts instead of arrest warrants. They push pills instead of powder, but the outcomes are just as deadly. They don't just operate in the open, they're celebrated. They win awards. They cut ribbons at hospital openings while fueling the very crisis those hospitals are drowning in. Every overdose death in this country, that's not just a tragedy, it's a return on investment. It's a line item in their quarterly earnings report. 2. Sales pitch, a death sentence in a pill bottle. Let's talk about OxyContin, Purdue Pharma's golden goose. It was introduced as a revolutionary, non-addictive solution for pain. Non-addictive. That word was their get-out-of-jail-free card, except it wasn't true. They had no long-term data, no real-world evidence, and absolutely no concern for what would happen when people became dependent on it. They didn't just mislead doctors, they engineered belief. Purdue ghost wrote studies to say what they needed said. They sponsored 5-star conferences with open bars, luxury suites, and endless perks. They didn't educate, they indoctrinated. Prescription pads became commission slips. Doctors became dealers with degrees. You think your doctor was just trying to help? Think again. Many were cashing in, knowingly or not. Free golf trips, all expense paid vacations disguised as conferences, honorariums to speak at events. You think a few $1,000s didn't sway prescribing habits? Think again. Your chronic pain? That was a sales pitch. Your addiction? That was the business model. And when you became dependent, when your life unraveled, where was the accountability? Nowhere, because your suffering was never the problem. Your repeat prescriptions were the goal. This wasn't healing, it was a hustle. Your dependency was their dividend. The supply chain, industrialized addiction. Let's break down the logistics of this legalized trafficking operation. Manufacturers like Purdue Pharma would roll out a new and improved opioid every few years. Each time, they claimed it was safer, less addictive, more effective, but chemically, it was almost always the same drug in a different package. A new name, a new ad campaign, a new wave of destruction. Then come the distributors, names like McKesson, AmerisourceBergen, and Cardinal Health. These companies shipped literal tons of opioids to tiny rural pharmacies ordering hundreds of thousands of pills a month. More pills than people in their towns. Red flags? They saw them blinking like a Vegas strip and they hit approve anyway. The numbers don't lie. In British Columbia alone, over 2.6 million opioid prescriptions were filled in a single year. That's not compassionate care. That's a distribution network. Think about it. If a street dealer moved that kind of product, they'd be behind bars for life. But Big Pharma? They collect bonuses and release statements about corporate responsibility. This wasn't a public health failure. It was a well-oiled corporate conquest. 4. The addiction trap, from prescription to poison. By 2012, the writing was on the wall. OxyContin was reformulated to make it harder to crush and inject. Doctors started pulling back on scripts, but guess what? The damage was done. Addiction had already taken root, planted and cultivated by the industry that was now backing away to cover its tracks. Patients weren't offered detox, support, or safe alternatives. They were abandoned, cold, and the streets picked up the slack. Fentanyl entered the scene with a vengeance, 50 times more powerful than heroin, dirt cheap, easy to smuggle, and lethal in micrograms. People who were once on prescription painkillers were now injecting or inhaling fentanyl-laced street drugs just to keep the withdrawal at bay. By 2017, 80% of overdose deaths in BC involved fentanyl. Now it's nearly 100%. This is a legacy Big Pharma left behind, a population chemically dependent on substances they created, with nowhere to turn but the poison street supply. And the worst part? They knew. They saw it coming. They had the data. And they chose profits over people every single time. 5. The settlement. Blood money in a briefcase. In 2022, Purdue Pharma Canada agreed to a $150 million settlement. The media called it landmark. I call it insulting. Let's do the math. BC has spent billions cleaning up the mess on emergency rooms, overdose response, social services, child apprehensions, funeral costs, and criminal justice fallout. 150 million doesn't even scratch the surface. It's a rounding error on the spreadsheet. It's less than some executives made in bonuses. Imagine if a corner dealer walked into court and offered cash instead of jail time, we'd laugh in his face. But Big Pharma, they paid the fine, updated their website, and got right back to business. No one went to jail. No one lost their license. They just called it settling the matter. This wasn't justice, it was a transaction. 6. The power play. The system isn't broken, it's working as designed. Ever wonder why this keeps happening? Why the response is always too little too late? Because Big Pharma didn't just manipulate the market, they hijacked the regulators. Health Canada, the very body that's supposed to protect the public, has been caught again and again, dragging its feet on warning labels, delaying action while industry lobbyists rewrite the narrative behind closed doors. The people screaming for culturally safe solutions, harm reduction, and lived experience inclusion, they're drowned out by corporate interests whispering into policymakers' ears. These aren't accidents. These are decisions. Calculated, cold, profitable. When corporations write the rules, justice doesn't stand a chance. 7. The human toll. Indigenous lives as collateral damage. Let's be crystal clear. The impact hasn't been equal. Indigenous communities are dying at staggering rates. Despite making up just 2.6% of BC's population, Indigenous people, especially women, are experiencing fatal overdoses 5 to 8 times higher than non-Indigenous people. These are not numbers. These are daughters, mothers, elders. These are generations being erased under the weight of colonial violence and corporate greed. Rural communities, too, have been gutted. Places with no safe supply access, no naloxone kits, no public health infrastructure, just silence and grief. This isn't an opioid crisis. It's genocide by prescription, and no one's being held accountable. 8. When the smoke clears, who's left holding the bag? When the headlines fade and the lawsuits settle, who's left to pick up the pieces? Families, mothers planning funerals, kids growing up without parents, communities traumatized by the daily toll of grief. Meanwhile, the architects of this catastrophe are sipping champagne, cashing checks, and preparing their next marketing campaign. Make no mistake, these are not overdoses. These are corporate executions, each one signed off by a suit in a glass tower who knew exactly what would happen and did it anyway. So now, ask yourself, who are the real criminals here? Thank you for listening to Detoxing the Discourse. If this episode made you angry, I'm glad. It should have. Share it. Talk about it. And remember, the most dangerous lies are the ones wrapped in credibility and sold as care. We'll be back next time to peel back another layer of this ongoing disaster. Until then, keep asking questions, keep demanding the truth, because truth, when wielded unapologetically, is the sharpest weapon we've got.